Welcome to the GAPNA Health Policy Toolkit. This is to provide information to all of you that desires to advocate for the nurses and for your patients. What is health policy? Health policy can be any law, regulation, or policy that affects health. It can be at any level, whether it's where you're working, whether it's in your community, nationally, globally. It covers diseases and conditions, where you live, where you work, the safety. It covers global health. And if you're concerned about gun law, that's an excellent example of policy regarding violence and safety. GAPNA has policy priorities. Our two major ones: care of older adults. We want to promote the role of our nurse practitioners as they care for our older adults, regardless of the setting that they work in. The geriatric workforce. This addresses the need for clinicians and caregivers to be adequately trained. So how can I influence the policy process? The best way is to advocate. Why? Well, chances are you are advocating for your patient already. You're a professional, and we know that the most effective method to creating change is to advocate. So what is the difference? I don't want to lobby. I don't want to make policy. Well, lobbying generally are individuals that are paid to represent organizations, groups, members that have a particular need, to meet regularly and urge officials to either support or oppose legislation. Policymaking is allocating scarce resources in a particularly charged, highly competitive environment. And a good example of this was when COVID pandemic started and the need to get protective personal equipment out to everybody. So advocating, you can speak, you can write, you can support, you can urge, and this is something you can do individually or as a group or an organization. Okay, I don't have time. I'm a parent with a young child. I really don't understand how to go about this. How does the political process work? I mean, it seems like they have all these committees and they do all these different things. All of this can be intimidating. That is why we have the toolkit. We will talk to you in this particular area about the types of advocacy. And then we have links to the legislative process where you can learn about that, and also how to contact your legislators. We stated earlier that chances are you advocate for your patient. If you're involved in discharge planning, that's an example of it. Coordinating care with the patient's insurance. How many of you have had to call and give prior authorization? Well, you are advocating for your patient. It's always easier to go with what the insurance will do than to make that call that you don't get reimbursed on. Reaching out to the community service to assist in helping your patient get what they need if they cannot afford it. Where you work, you can work with administration or nursing leadership for policy change to improve services. a professional organization such as GAPNA. Join it. Engage with the Committee on Health Policy. You can contribute to the Political Action Committee's PAC. This is where they donate to different candidates to support and endorse the things that we have a particular interest in. You can participate in a grassroots effort, which we do periodically. You will see on the GAPNA Exchange where we say, please contact your congressperson to support this bill. That's a great example of grassroots effort. In the community, you can educate the local council members or the residents. And there's broad levels in what I call just takes a little bit of effort. Go vote. You are one nurse with a vote, and every vote counts. Put a sign in the yard for your candidate of choice or campaign for that candidate. Sign petitions. On a higher level, you can send a letter, and this is not complicated. We have some examples for you, and the easiest way to do it is by email. Making comments on federal policy. When this comes out of something of interest to us, we send that information out. You can go in as a consumer, as a citizen, as a nurse, as a patient yourself, and make comments. Contact your legislator when they're in town. Usually, when you do that, we have information that we can provide to you. Writing policy briefs or position papers, we generally do this at an organizational level. Providing written and verbal testimony, we will help prepare you for that. You want information on how to contact your legislator? Click on this link. You want to learn about the legislative process? Click on this link.